Hello, everyone attending the One Artificial Intelligence Conference. So this session is going to be about the use of AI in robotic surgery systems in the future. And we're going to walk through a presentation about that, which you'll see here on the screen. So my name is Roger Smith. I have a PhD in computer science. I am not a surgeon. So I talk about this from the technology's perspective, not from the clinical, surgical, in the operating room perspective. Though I've been in the operating room with dozens of surgeons while they've been doing these procedures. My experience in robotic surgery is primarily with the Advent Health Hospital System, where I spent 10 years as a research scientist studying this topic. I also was privileged to work with the Society for Robotic Surgery and the American College of Surgeons in creating a number of curriculum and standards in the robotic surgery field. And we worked with the robots and the scientists from Intuitive Surgical, CMR Surgical, Medtronic, and a few other smaller companies. So those were very hands-on, concrete experiences with societies, hospitals, and device manufacturers. More recently, I've been translating that expertise into medical fiction about the future, almost science fiction. I've published 4 novels that explore what robotic surgery will be like in 20, 30, 40 years and speculate on the technology that will be used to assist surgeons and the role that will be played between the human surgeon and the machinery that's available. And one of those technologies, of course, is artificial intelligence. So some people in this conference probably don't know what robotic surgery is. So I'm going to give a little background before we get into the AI component. Typically, surgery is described as falling into one of 4 different generations. The first generation, or surgery 1.0, was open surgery. And that's how your grandparents had surgery. You went into the operating room, they sliced you open with a scalpel and stuck their instruments and hands inside to remove your appendix or work on your bowels or whatever they were going to fix. And then surgery 2.0 is minimally invasive, which became very popular and prevalent in the 1980s. So this is the kind of surgery that your parents probably had, or maybe you had, in which instead of cutting a large incision, you make a number of tiny incisions and you insert small versions of those instruments from different angles, that hence the multiple incisions, to do the same procedure. Much less blood loss, much less damage to the muscle tissue, the nerve tissue, smaller surface open to infections, the number of advantages. Surgery 3.0 is robotic assisted surgery. And currently, almost all of these procedures are human plus robot working together. Very, very few are robot working independently so far. And so you might have your prostate removed, you might have a hysterectomy, you might have a cancerous lung removed using robotic assisted surgery. And surgery 4.0 is speculation, but the experts talk about a robot that will be more knowledgeable about the patient and a more active participant. And that's what my science fiction novels deal with. A time when the robots aren't just passive and aren't just slave to the human, but they actually act for themselves and do part of the surgery and eventually all of it on their own. So those are the generations of surgery. And if you haven't been in this field, you might think that maybe robotic surgery is just a tiny fraction of the number of procedures being done. It is a tiny fraction, but it's rapidly growing. I've been able to count over 116 companies that are introducing robotic surgery platforms to healthcare. This is a list as of the year 2020 when I stopped changing it. It was just too dynamic. Too much was changing all the time. So this illustrates how big it is. And it's really impossible to explain all 116 of these companies and approximately 140 devices that they're selling. So I've narrowed it down to 2 that we're going to summarize here. Those are Intuitive Surgical's Da Vinci robot which covers about 95% of the market in robotic surgery, and the Stryker Mako robot, which is very capable and in a very different space. They don't compete with each other. They do very different things. So the Da Vinci robot is used for soft tissue procedures. Like I said, removing a prostatectomy, performing a hysterectomy, removing the cancerous lobe of a lung, certain ENT procedures down the throat. This machine is used for over 1 million procedures every year, probably approaching 2 million by this year. And it is a slave to the human surgeon. The human surgeon moves their hands and makes all of the decisions, and the arms on the robot move in sync with the surgeon's hand movements and their foot movements and their commands. And so all it does is improve the precision and the access that a human surgeon would already be doing if they were doing this with minimally invasive or open procedures. All right. So as I said, over 1 million procedures done this way. If you want to know more about this robot, I've included a YouTube link to a great summary video. The other robot, which I said is very different, is the Stryker Mako robot, and it's used for hip and knee replacement surgeries. And it's a little different from the Da Vinci. The human is still involved, and the robot doesn't move unless the human's hand moves. But this robot more actively participates and limits what the human can do. In these procedures, before you ever step into the operating room, your leg has been imaged from every direction. And the surgeon has made a plan of which bones he wants to remove and how much of that bone, what angle a hole needs to be drilled into the bone, and how deep. And all of that is loaded into a computer that feeds that information to the robot as well. And the robot's job during the procedure is to make sure that the human's hand does exactly what was planned earlier before the surgery started, and to indicate when the human's hand may not have done something that was in the plan so that the human can go and do it. So this is very much a collaborative working together. And again, the role of the robot is to make the human more precise, more accurate, less prone to error. So the patient gets a more reliable and a more predictable outcome than they might with a surgeon whose hand might be a little wobbly or who might make a little bit of a mistake during the procedure. So those are two big use cases for bringing AI to robotic surgery. Now, how might AI be used in surgery? Well, I think before you start imagining it being used in the operating room, you should think about how it could be used preoperatively before the surgery ever begins. When the doctor is looking at your medical records, when they're taking images of your leg, when they're building that plan that I talked about, that's a great place for AI to be added to intervene to make the process better. First, the AI could compare your medical records, data about you, to the data that it has about thousands of other patients who are similar to you, and give recommendations or predictions on how your procedure should be conducted and what should or should not be done for you because of the way it was done with for 1,000 other people. It's a great application. Another one is in that planning process I described. The AI, with all that knowledge of thousands of different procedures and outcomes, could make recommendations during the plan, things that it sees in other procedures that were very successful that the human surgeon may not have suggested or considered yet. And then the third one is in preparation. The surgeon could use a simulator to prepare for the procedure before they ever get it, essentially rehearse it. And they might rehearse on a generic version of your anatomy, or they might be able to rehearse on a very specific version, simulation, model of your anatomy. And while they're rehearsing, an AI can watch that rehearsal and identify when what's being done is not the best or suggest the best way to do it before it gets started. And so the surgeon has somebody with much more experience because an AI can integrate and process thousands of procedures, but also millions of procedures. Remember, I said that the Da Vinci is used for over 1 million procedures a year. Imagine that the AI has been trained on all million of those from one year and 1 million from the year before. And so it has a lot more experience, quote, experience, than any human ever would. And so it has a lot of good advice to offer. So that's probably where AI will be used before it's ever used in the operating room. Now let's step into the operating room. You're in the procedure, you're on the table, your trusted surgeon and his robot of choice are standing over you doing the work. Again, this is where the AI could make recommendations dynamically, not on the plan what you intend to do, but based on what it sees happening right now. It could make suggestions for an alternative that appeared to be second best when they were looking at the data before they got there, but something has changed. They have more data once they're actually doing the procedure, and the thing that was second best might actually be the best, and it can suggest switching to that. The second area is control. And this is the most controversial and the most exciting from a science fiction point of view. We imagine that the surgeon gives control of one of the instruments to the AI and lets the AI control the robotic arm that's holding that instrument. So the AI is actively participating. It's an assistant to the surgeon. And if it can control one instrument successfully, perhaps it can control two and maybe three, et cetera, and et cetera. So that's a path towards a much larger role for the robot, but mostly because the robot is getting smarter, not because the robot is a good machine, but because it has a good knowledge base from the AI. And then finally, there's warnings. When the AI sees something that has gone wrong, it can raise an alert and tell the surgeon, I see a pool of blood accumulating, or I see that we've cut something we shouldn't have cut. And the surgeon may realize that as well. But in the event that the human surgeon, doesn't catch that, the AI can alert them and then maybe help take proactive action. And then the third phase is post-operative. The procedure's over, you're in the recovery room, you're waiting to go home, and it can give you an expectation for what your recovery might look like. It knows you, it's known you from the beginning, and so it knows what your recovery path is most likely to look at, like what you will feel like on day one and day two and day three, what symptoms will change on day one and day two and day three. If you've experienced surgery, as I have a few times, you know that at the end of an exam or a procedure or a surgery, very often you'll be handed a Xerox copy of a set of instructions that are given to every single patient, regardless of who they are. And if they're really advanced, it actually has some blanks where the doctor has jotted in some figures that he added to your expected outcomes. And so that's how it's personalized by filling in a blank. That's very crude, and you know when you go home that that isn't as helpful as you would wish it could be. And then the last thing that a AI can do post-operatively is learn from your case. The case it just did with you might be something very unique, useful. It might have learned a nugget of information that it hadn't seen before that needs to be rolled into the global database. And so it uses your case to learn to do the next case tomorrow even better. Now, not only does the robot that was used on you or the AI that was controlling it learn it, but every AI in the world that's controlling that robot learns the same lesson at the same time. And so these AI can improve on a daily basis, whereas surgeons usually improve by going to conferences and listening to their peers present use cases. So that's a much smaller number of improvement points and a much slower process. So that's the global overview of this. I want to show you a few really illustrative examples of what you can do if you have AI in these robotic systems. So multi-fingered instruments are a great example. To accomplish some of what I just described, the instruments could be custom designed to do the job that needs to be done. Now, you might be aware that for centuries, surgical instruments have taken two forms. They're either a blade or they're scissors, graspers kinds of instruments. And there are variations on that that are a little more advanced. But that one finger or two finger design is pretty much predominant through all surgical instruments. And there's no reason why an AI controlled instrument has to be limited to the thumb and index finger of the human surgeon or even their entire palm. It could have dozens of little manipulators on the end that are custom made specifically for the job that you need to do in prostatectomy or hysterectomy or a cancer tumor removal. And that instrument isn't controllable by the human hand because it's too complicated, but it's controllable by an AI who knows how to do that. Another one would be spherical vision. Currently, robotic systems and minimally invasive systems use a camera that's like a soda straw. It slides into the body and it provides a beautiful high definition and maybe three-dimensional view of the tissue right in front of it, but you're always looking through a soda straw. And if you want to survey the inside of the abdominal cavity where you're working, you have to steer that soda straw around to look everywhere. And if you used a spherical camera that looked in 360 degrees at all times, the human surgeon could still only look straight ahead with his eyes, but the AI controlled camera or vision could look at the entire scene all the time. And so it could see a bleeding vessel that's way off to the left on the periphery that the surgeon might not catch for several minutes. And the AI could alert him and say, there's a bleeder over here. You might want to go over and address that immediately before you continue with the procedure, for example. And when you have a camera in the body, there's no reason that you only have to have one camera. You could have multiple cameras looking from different angles and integrate those all into a single 3D image of that virtual world, the way self-driving cars kind of do. So that image is more than a human mind and eye can absorb at one time, but it's not more than an AI-controlled camera can process at one time. Some of those cameras could be tiny rovers that get driven around so they can see down into little crevices. And instead of having a human assistant that has to drive those little roving cameras, the AI could drive them and then, of course, integrate the imagery in. And the imagery doesn't have to be just the visual spectrum. It could be hyperspectral across many different wavelengths. And the AI can process that data as if it were seeing it visually, which a human can't do. And then finally, there's the idea of a smart teaching robot, or smart teaching simulator, which I hit on earlier. But a simulator that doesn't just score your performance, but that already knows how to do the procedure better than you do and can coach you along the way. It can tell you what you need to do when you're doing it right or wrong. And it could even bump the instruments and help you get your hands into the right positions where your performance would improve more rapidly than if you just try to understand its instructions. Those kind of intelligent, dynamic, and participative simulators don't exist right now. But with AI control, you'd have something that was smart enough to give that kind of push to somebody while they're learning. Okay, as I said, I write science fiction novels about robotic surgery. These are the three that I have written so far, and you can get them at that website, rddsmith.com, where I explore these ideas in the context of a story that makes them feel realistic and show what these kinds of technologies would mean to the surgeon and to the hospital and to society and patients in general. So I think AI is not just a better tool like a robotic surgery platform is, but it's actually a better partner and will improve surgery when it becomes a partner to the human surgeon and the human team that's doing procedures. So thank you for letting me talk to you today. That was fantastic. I appreciate it, and I hope you enjoy the rest of the conference.